Now, what are the symptoms of heart disease or cardiovascular disease? When we mean by symptoms, these are the complaints which the patients come out with. That is called as symptoms. Now, there are four cardinal or four important symptoms of cardiovascular disease. The most common and the most sinister one, where the patients are really worried, is chest pain. Chest pain, because of cardiovascular origin, because of the origin of the heart, is many times people confuse it. They always think that any pain coming on the left side of the heart is from the heart, but that is not entirely true. The pain which comes from the heart usually, most commonly, is because of blockage of blood vessels supplying the heart, which we call as coronary artery disease. And then if it is a very stable syndrome, like the block is there for quite some time, then people will have chest pain typically on exertion. It doesn't matter where the pain comes, but if it comes when the patients exert, when they walk, when they climb stairs, it is more likely to be from the heart rather than from any other organ. It can be in the center of the chest, it can radiate to both shoulders, both arms, right in the back of the chest, and sometimes even come to the jaw. And whenever this pain is brought on by exertion, then it is most likely from the cardiovascular, because of the heart. And then of course the heart pain, chest pain can be because of some other conditions like valvular heart disease, pericarditis, where the coverings of the heart can get inflamed. The pain will have slightly different characteristics in such conditions. The pain may be localized to a particular segment. Features pointing against cardiovascular origin of chest pain is that if the pain is very localized to a particular point of the chest, if the pain increases on deep inspiration, if the pain increases on movement of the chest, all this pain is less likely because of the heart. The second most common symptom of the heart is breathlessness. Though breathlessness is one of the characteristic features of cardiovascular disease, that is when patients become breathless on walking, out of breath, they have to stop to take deep breaths while walking or climbing stairs or doing any exertion. This may not be entirely because of cardiovascular disease alone. Respiratory diseases, lung diseases also can present very much similarly. So we have to separate between the two based on their clinical characteristics. The third most common symptom of cardiovascular disease is fatigue, tiredness. People will not be able to perform their daily activities. They may become tired progressively. They may stop walking the distances which they used to walk. They may avoid lifting weights. They may restrict their physical activities because they are becoming very tired. So usually tiredness or fatigue is a marker of low cardiac output. If the heart fails to perform, if the heart fails to pump adequate blood to all over the body, then people present with fatigue. And the fourth one is palpitations. Palpitations is undue awareness of one's own heartbeat. Normally we don't perceive our own heartbeat unless we exert extremely. When we run and stop, then we may perceive the heartbeat. Otherwise, most of the time we don't perceive our own heartbeat. Now, if the patient starts perceiving the heartbeat at rest or even when he is sitting comfortably, then there may be 2 or 3 mechanisms which are essential to develop these palpitations. The most common one is increase in heart rate. The second one is change in the rhythm, and third is change in the force of contraction of the heart. The change in rhythm usually because of arrhythmias, either it is because of fast heart rate or slow heart rate or irregular heartbeat. All of them can be perceived by the patient as uncomfortable feeling, abnormal sense. They may complain of missed beats or skipped beats, and very fast heart rates may become very uncomfortable for the patient. Many times they may complain that I am sitting but my heart is racing. And the third is when the force of contraction increases. Usually when there is leakage in the valves, when the valves don't open very well, then the force of contraction increases, thereby causing a lot of palpitations. These are the 4 most important cardiovascular manifestations or the symptoms because of heart disease.